All right, good morning, everyone. Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractic physician at Gatesway to Health. Today we're talking about chronic traumatic encephalopathy, and is this something we can prevent? And we're joined by Kathy. Kathy, good morning.
Good morning, everybody.
All right, and any thoughts you had, Kathy, to start this out?
Why don't you just recap kind of what we've been through,
Last few weeks.
what happens to the brain after the traumatic brain injury? Just give us that.
Okay, so recapping that, as we talked about in a couple broadcasts, the blood-brain barrier, which are the blood vessels that go into your brain, and I don't really have them here in the brain model, but just as an analogy, the blood vessels go into the brain. Think of them as a tight pipe, and you don't want holes in the pipe. After a head injury, there can start to be holes in the pipe that form, and then immune cells from your body can go into the brain. We have direct evidence from basically football players where they can see signs of brain tissue breaking down and coming out into the bloodstream. That sounds like a gross thing, but it's not that severe. It's basically they find evidence of brain proteins that you can see in the bloodstream after head hits. So we know that the blood-brain barrier does break down after head injuries. We also know that the neuropathological changes in the brain can happen after one severe head injury, analogous to what's referred to as chronic traumatic encephalopathy, which is where if you think of your brain cells as like a room, and in this room we have 2x4s supporting the room, well, if the 2x4s start to crumple and crinkle, or things start attaching to them and pulling them down, that is analogous to the phosphorylation of tau protein that we see in chronic traumatic encephalopathy. As we discussed last week and the week before, we now have new imaging modalities, which I was talking to a colleague about yesterday, where we can actually inject a radio tracer into someone's bloodstream, do a specific type of brain scan, and actually see if there are signs of hyperphosphorylated tau in the brain. That's huge because a lot of people who have sustained multiple head injuries wonder, am I going to get this thing called chronic traumatic encephalopathy? Am I going to be like other notable famous athletes, so to speak, who have suffered with brain issues late in life? So we're getting closer and closer to being able to predict if somebody is on that path. We also can see volumetric changes in the brain. So basically, is the brain as dense as it should be compared to age-matched normals? And we're now getting more and more information about this issue and saying, well, we're seeing this pattern of atrophy in people who have had head injuries or repetitive head injuries. So that's kind of the summary, Kathy.
Okay.
Anything else?
We kind of talk a lot about the gut and the brain. So what happens exactly to the gut immediately following brain injuries? Is there a big deal there?
Yeah, there is a big deal, and that's what's so interesting. So if you search on PubMed, there's about 16 articles in relationship to the gut barrier and traumatic brain injury. First dating back to 2003, which is actually quite a while ago. That's actually pretty novel for them to be looking at this in 2003. And in essence, what they have to do these studies on mice. Now, are mice directly a correlation to human beings? No. But lots of times we have to start there in terms of doing scientific research. I'm not trying to get into animal stuff and all that, but it's just that's the model we have to use to figure this out. So basically what they did is they went in and they started, unfortunately inducing brain injuries in these mice, and then they would go in and look at their gastrointestinal tract. They would look at proteins and how they're being absorbed, and they saw a leaky gut within 3 hours after traumatic brain injury. So what is leaky gut? Leaky gut is where your intestinal cells, which are 1 cell layer thick, your skin is several cells thick. Your intestinal skin is 1 cell layer thick, bound together by these proteins, occludin and zonulin. And they found that these proteins were breaking apart within 3 hours after traumatic brain injury. Really significant. And since then, other researchers have confirmed the same thing. That's a big deal. So we know right after brain injury, not only does your blood-brain barrier break down, but your gut barrier breaks down.
And what we talked before about the blood-brain barrier, everybody kind of think of it as a coffee filter. It's keeping all the good stuff where it should be, the bad stuff where it should be, and it doesn't mix. But when it's broken, then it can get through and do things it's not supposed to do.
Right.
So, and if we get a leaky gut, we've got other things going into our bloodstream, other things getting up to the brain, causing our old friend inflammation, correct?
Absolutely correct. I love the coffee filter analogy. That's awesome. Uh-huh.
That's what you pay me the big bucks for.
Oh my gosh, you're funny.
So that's the way I take it, and that's the best way for me to visualize it as to how that looks and what happens and transpires. But, you know, we talk about inflammation probably 90% of the time because it causes so much havoc on the rest of the body.
Yeah, it does, without a doubt. Without a doubt, it is the cause of so many different illnesses. And also, Kathy, I'm going to pause there. We had some questions proposed to us, and I'm trying to receive those or retrieve those from our messaging thing here on Facebook. But if you want to repost your questions, everyone, that would be really helpful because I'm having trouble getting to that. So let's keep going, Kathy. What else did you have?
Okay. So what happens, or what is endotoxin, and how does it relate to this topic?
So endotoxemia is described in bacterial infections, particularly involving gram-negative bacteria. And gram-negative bacteria have this, think of it like a tail. Many of you, I don't know, if in science class, you remember in 7th grade, you may have looked at like flagellates, these little flagellate microorganism parasites. Basically, that's what they are. They're in murky water, things like that. Well, they have like a little tail on them. Well, basically, these gram-negative bacteria kind of have a tail on them as well. And in essence, these tails can break off and go into the bloodstream. Or if the bacteria is living in our body, then those tails can break off. And they're highly inflammatory. So you see endotoxemia, the lye tampon scare back in the 80s was the classic example of endotoxemia, where pieces of these tampons were staying in the body, and then these bacteria were growing on them and creating quote-unquote toxic shock syndrome, where then people would feel really sick and they had all these nebulous symptoms. I actually had a friend who had this. It was very interesting. Well, when she was better. So anyways, with endotoxemia, what we're finding is that we get what's called subclinical endotoxemia stemming from our intestines. So you have 37 trillion bacteria in the intestines. All the research on the microbiome has shown that as we shift towards inflammation, like Kathy was talking about, our inflammatory state, there seems to be this dysbiosis pattern where we get more and more inflammatory bacteria, and we absorb pieces of these tails of these gram-negative bacteria, which is called endotoxin. So when you start looking at it in this bidirectional communication between your gut and your brain and your brain and your gut, so what happens? You injure your brain, boom, within 3 hours, the gut starts to break down. I talked about this study in 2003, but other studies have confirmed the same thing. So now the gut starts to break down. Well, now what they're finding is that can lead to absorption of bad pieces of bacteria, endotoxin, which can then cause inflammation in your body, which then goes into your brain. When they do studies on leaky brain, guess what? If independent of a head injury, guess what they're injecting into a person or a mouse if they're trying to see if they can break down the blood-brain barrier? They inject endotoxin. They inject lipopolysaccharide. That's what it's termed. So that's a really, really important thing, I think, for all of us to know, that most of the research on the blood-brain barrier, they break it down with endotoxin. So now you hit your head, brain barrier breaks down, gut barrier breaks down, pieces of bacteria come in, and now your blood-brain barrier may be breaking down excessively. Now, why do some people develop post-concussion syndrome and others do not? And I think that this is pivotal to that argument, and that probably the gut barrier and the blood-brain barrier heals in those who recover from their concussions. And those who don't recover from their concussions, there's a strong probability that maybe these barriers are not healed. Are there other factors? Yes. Kathy and I have talked extensively about POTS and orthostatic hypotension, things like that. So if you have damage down here in your cerebellar brainstem networks coordinating blood pressure, that can certainly lead to persistent symptoms of fatigue and brain fog and things of that nature. But these barrier issues have to be paid attention to. In fact, they're even doing research now where they're giving mice probiotics after head injuries and finding that basically they don't have the same effects as mice who don't receive probiotics. That's been done with different Clostridium species and Lactobacillus. Researchers are also doing what's referred to as vagal nerve stimulation. The vagus nerve is our quote-unquote parasympathetic nerve that goes to most of our digestive organs, abdominal viscera, first 2/3, I believe, of your colon. So it innervates a lot of our abdominal contents, and it drives parasympathetic rest and digest signals to those organs. And so what they do is they put basically an electrical stimulator on the cervical portion of the vagus nerve in these mice, and they find that they can induce a traumatic brain injury, and then the effects are minimal if they did this vagus nerve stimulation ahead of time. Why? Because it's healing their gut. So does that kind of make sense, Kathy?
Yeah, I think so. I'm having a hard time getting all of that, but
Okay.
So if we're stimulating the vagus nerve, how is that causing their traumatic brain injury?
It's not. Basically, by stimulating the vagus nerve, it's stimulating really good impulses for the intestines to be healthy.
Okay.
And then when they induce a traumatic brain injury, the gut doesn't break down.
Okay. All right. And I get all that.
Okay, which is kind of wild. It's kind of cool.
And we just, the main thing here is brain barrier breakdown, gut breaks down, stuff's floating around that's not supposed to be.
Right.
And that's where the inflammation comes from. But if that's allowed, and you mentioned people who are allowed or their concussion heals, and we've talked about that repeatedly, football players going back into play before they're ready, before they've had a chance for that to heal, which is going to, I know, give them a bigger percentage of a chance of CTE.
Mm-hmm.
So, I mean, we kind of beat that horse to death. Okay, if a kid's hurt, give him time, let him heal. What do we see in, like, car accident victims and that sort of stuff? I mean, they're not going to be thrown back into a game, so how do they heal? I mean, is it just time that's going to heal it, or are we going to do something else?
Well, I mean, time is basically the standard recommendation, and you may be referred to physical therapy. And that's really the question. I would say if somebody's having persistent symptoms, then probably things haven't healed. And that's where you really want to start looking at, and we get questions, specific questions. Okay, well, I've tried the paleo diet, or I've tried going keto after my concussion, and I'm still not better. I don't know what to say to that, except that there can be more complicated mechanisms going on. And even though you may be handling some of these issues on the surface, it may not be enough to help your specific situation. On the flip side, it'd be very interesting to do a study where you could basically take a variety of head injury athletes and put them on some sort of certain dietary regimen for months and see if it would have some sort of protracted effect in helping their brain inflammation. And when we say, can we prevent chronic traumatic encephalopathy, that's not just us saying this in this broadcast. This is being talked about in the literature. These articles I'm mentioning, they're talking about this relative to the microbiome in the gut. This is a question, because the only other route that I'm finding that people are trying to use are to basically those biologic drugs that we talked about, Kathy, where they create monoclonal antibodies to the cis form of tau. So I don't know, trans and cis, if you take organic chemistry, you'll know that there are different conformations to proteins. And so they're making these immune cells that will basically attack tau, and that's their hope to prevent chronic traumatic encephalopathy. Was that probably, if it works in humans, it's going to mean you're going to see advertisements for expensive medications to prevent that issue. By the flip side, if you've had head injuries, or if you're a parent and your child has had sustained head injuries or repetitive head impacts, we would say it that way, maybe do you want to look at their microbiome? Do you want to look at their gut? Do you want to test their blood-brain barrier? Those would be feasible questions. Also, would you want to get some brain imaging? Because there was actually research I was reading this morning, Kathy, out of Las Vegas, interestingly enough, where they were studying, it's some fighters study, and they basically showed that a lot of these fighters who go on to experience depression, things like that, they have, guess what, volumetric changes in their brain, where areas of the brain are less dense. So that's kind of the take on that.
Okay, so we have the damage. We know we're talking about a lot of scientific stuff that's going to be available, like you said, pretty expensive stuff that probably will be coming out that can affect the tau. But normally we would let the concussion heal on its own, give it time, try not to injure it any longer. But still, we feel like, as a general rule, probably going with a diet that's going to cause less inflammation, less the leaky gut kind of thing, whether it's gluten-free, keto, paleo, whatever it is, depending on the circumstance. That's kind of what you look at when you see a patient like this. You kind of do your assessment and then figure out what route to take. And as you said a minute ago, you don't know the answer to all of these because you haven't seen all these people. So if they're giving you questions, you can only go from generalities of what you've seen in the past.
Right, exactly.
And from those generalities, you've come to a pretty good conclusion of how you can help a lot of people. So if we follow those, we're on a good track. It's not going to take care of everyone, but as you said, the imaging is going to become more important all the time, and that kind of, again, gives you the assessment of what you need and what path to follow to help these folks.
100%. And when you were saying some of my experience, I harken back to a patient we saw who had a number of head injuries, and they went and ate breakfast. They were feeling really good after we treated them. They went and ate breakfast, and all of a sudden they developed a 10 out of 10 headache. And they ate a certain dietary protein that they were intolerant to. How do you explain that? Well, explain it because basically their gut, is like Swiss cheese. Not really, but from a molecular standpoint, some proteins, their immune system got activated against those proteins here. And in essence, it induced inflammation in their brain because their blood-brain barrier was broken down. That's the theoretical mechanism. And that's not the only patient we've seen that in. So that's all we can say more and more, but I would say for any loved one of someone who's had repetitive head injuries, I really think you need to look at the microbiome, your gut health long-term, if you want to maybe make a change in your brain long-term. And the effects may not be immediate. Like Kathy and I talked about in our radio shows when we were doing those, they can take 3 months to make any type of observable change in your gut bacteria after a dietary change. So
it doesn't usually, though. In most people, or in a lot of people, or in my case. But I'm just thinking of how we're talking about this in the gut, and what you do normally help people who have arthritis or whatever the situation is that is caused by inflammation. And yes, the concussion has a lot more stuff to deal with it, but we're still kind of dealing with the microbiome and the brain. Because if you've got a bad microbiome, a lot of people have brain fog and stuff anyway.
Right. Great point.
So, I mean, the two are so connected. I think that's something that we really just need to get on is, can't think of your brain as just this computer on top of your head because it runs the rest of your body and the rest of your body affects it.
Right.
So it's kind of like leaving a window open and letting the rain come in. And, there's a lot of bad stuff that could come in through that window. So,
that's another great analogy. I like that one.
Well, we need to close. I'm on a roll today. What can I say? So we really have to think of, these analogies are always good. I think of a sieve. There's lots of things. We got to think of a way that things can get through, that the bad things are getting through to the good stuff. And like we know, bad stuff usually wins. So we gotta prop up the good stuff and do whatever we can. If that means eating paleo or gluten-free, whatever it is, to get the microbiome to be strong and healthy as possible, then we're going to see good results all over. And if you've been unfortunate enough to have a bad concussion or a car accident that caused brain injury, whatever, it really more than likely isn't gonna hurt. It's not going to hurt anything, and it sure could help something.
Right. I totally agree. I love that. I love it. Said perfectly. And we had a comment here, Kathy. The normal Western doc would think parents were nuts if they said, hey, let's test my kid's microbiome. And you're probably absolutely right. And the problem there is that all this evidence on the microbiome is relatively new. It's exploded really in the last 8 to 10 years. And, having been in practice around that time, talking about gluten was almost like hush hush. Like, you don't want to say this in a public setting. Now it's out there, but it's public information more than that. I mean, it's ubiquitous. Whereas the microbiome, a lot of doctors may just not be up on the current research. Even gastroenterologists, most of this research comes from gastroenterology journals, but so often when my patients talk to their gastroenterologist about, things like leaky gut, and leaky gut's a horrible term. I didn't invent it. I don't like the term, but that's just what's being used in the scientific literature. Then, the patient gets the eye roll, and it's really defeating for a lot of patients. What you need to know as a patient is that there's so much research on this, and it's coming from everywhere. It's coming from Cornell. It's coming from Harvard. It's coming from UC San Diego. It's coming from all these big research centers. So rest assured in that, it's the current stuff, and lots of times it takes years before the current scientific literature really gets to the masses of physicians so that they can, be more informed. Because they're practicing a model, that is one way, and this whole microbiome thing is going a completely different direction.
And these schools work on funding, and they would not waste this money on this research if there wasn't, truth being found.
True.
So they wouldn't put their resources into this. They'd go in other directions. So there's a reason they're continuing with this. And those schools do compete with each other. So somebody else has a new finding, and they can come out and say, "Hey, this is what we found that's super duper, and it's going to help a lot of people." That's why they're in it, and it does help a lot of folks. So all the journals that you read and all the time that you spend reading all the research so that you can pass it on to us, we definitely appreciate it.
Yeah, of course. And I appreciate us working together as a group. I do. Absolutely. And, we're getting the information out there. And lots of times I really like to see the changes in families. One person starts on some sort of dietary change, and the next thing you know, grandma's doing it. And the next thing you know, you got, 20 people in the family changing their food paradigm, so to speak, to help their systemic health. And I really think that's what we need. And I basically getting to the point, I think that if you know someone who had a lot of head hits, with soccer balls, or if you know a football player, or if you know a boxer or a fighter of some sort who's had a lot of head injuries and you care about them, you may want to bring this information up to them. Again, information is where it's at. They can do what they want to with that information, but at least we got to get this information out there, because the effects of something like chronic traumatic encephalopathy, which we're now seeing is so common in these retired professional athletes, we need to start doing something. That's my take on it. And yeah.
The question I've always had is, you talk about different densities of brain. Does that make a difference in who gets injured? I mean, if your brain is really, really dense, are you less likely to receive that brain injury from that bad hit?
I can't say that. We don't have enough data on that yet. Basically, all we have is, right now we have studies comparing retired professional athletes who have had repetitive head impacts compared to normal controls, and we see the changes. I think there were even some studies in rugby players similarly, but I can't say comparing someone with a previously dense brain, would they be more resistant to atrophy? What we do know is that there's a probability of atrophy, but would they proportionally have less? Potentially. Yeah.
All right.
All right.
You ready to patients?
Yeah, it's almost 8 o'clock, so I got to get rocking and rolling. But thank you everybody for joining and all the comments. And so one of the last questions was, so we need to keep our gut healthy. Can we, and how? I would say the research is showing that you can keep your gut healthy. As we've mentioned, vegetarian diets seem to be the most healthy when it's mainly eating vegetables. That's just the research. Most of the research on the microbiome is saying that high saturated fat, high processed carbs are the worst things for the microbiome. When you look at that, that's the standard American diet. So the more healthy fats you can eat, the more vegetables you can eat. And one could say the less gluten you eat, that's basically your best bet for a healthy microbiome. I'm not prescribing that to any of you, but that's just the research. So yeah, I think that pretty well covers it. Kathy, anything else?
Nope, I think you said it all.
Okay. All right. Everybody have a nice weekend. Thank you, Kathy, and we'll see you next week.
Bye, everybody.
Bye.